Folks, do you remember all during the debate on Obamacare? Every day we were told X number of people were dying every day because they lacked health insurance. I mean, it was absurd. It wasn't this 43 million people don't have insurance. There are people dying every day. They were trying to attribute daily deaths to a lack of health insurance, pre-existing conditions. Has that number gone down since last March? We don't hear about it anymore. Ever since Obamacare was passed. Here's a Reuters story, September 18th, 2009. Study links 45,000 U.S. deaths to lack of insurance by Susan Hebe. Nearly 45,000 people die in the U.S. every year, one every 12 minutes, in large part because they lack health insurance and can't get good care, Harvard Medical School researchers found in an analysis. We are losing more Americans every day because of inaction than drunk driving and homicide combined, said David Himmelstein, co-author of the study and associate prof of medicine at Harvard. So according to this study, 123 people die in the U.S. every day because they don't have insurance. Now, we haven't heard that number since March when Obamacare was passed. We don't know what the number is. We don't know if that number has gone down. Shouldn't it be showing up by now? We got healthcare law. We got Obamacare. Shouldn't the number of people dying every day be going down? It's been almost a year since Obamacare was signed into law. We should have 45,000 more people alive and walking around that we didn't have before. Has anybody seen a death certificate that says cause of death, no health insurance? I haven't. Maybe you and the leftist blogosphere have, but I haven't. So what we have here is a guy who had colon cancer, got treatment, recovered from the disease, as best I can tell, and he's complaining about the system that saved his life. Calls here to complain about it. So he says, if he didn't have insurance, well, what then? What then? What's called Medicaid? It's called state pools. It's called high-risk pools. It is absurd. It offends me as an American to have people believe that this nation's healthcare system and that our own cultural morality sits around and lets people die. We do more to save lives in emergency rooms every year than most nations do in their normal scope of daily medical care. We spend a fortune. It's a literal fortune, folks. We spend a literal fortune on people who don't have insurance, including illegal aliens. And we continue to get these stories, these hypotheticals about what if and what if that, what if this. Now, if we didn't have Medicaid, if we didn't have state pools, high-risk pools, if we didn't have laws that cover the poor and pre-existing conditions, then they could make arguments like this. But we have all this. We have all of these redundant systems, plans, programs that handle and accommodate people. And yet they still make these arguments. The truth of the matter is, President Obama's healthcare system destroys our healthcare system. President Obama's healthcare legislation, his bill, destroys the healthcare system ultimately for all of us, including those of us who pay for it. And for those of you who pay for everybody else, too. It isn't aimed at pre-existing conditions. It's aimed at all of us. Health care quality is going to suffer proportionately to the percentage of this plan that gets implemented over the years. And yeah, it is extremely frustrating to have to sit here and know that there are gullible people who accept these out-and-out lies. And it's all political based. They accept it because they're liberal Democrats. Liberal Democrats run out there and claim that repeal of health care is a matter of life and death, and they believe it. And they start calling radio talk show hosts with anecdotal evidence of how it's true. Maybe what we ought to do is take a page from the Chi-Coms and their wonderful health care system. Give the patient an aspirin. And then when you run out of aspirin, shoot the patient in the head and then harvest their organs for transplants. Salve, salve. Everybody in this country has access to health care. Everybody does not have health insurance. Still, everybody can get health care. Somehow that always seems to get lost in the discussion when Democrats start talking. People are shameless, folks. These leftists are absolutely shameless. Have you ever noticed? George Will has a great column. Here it is. Here it is. The government disease, which is a correct word. It takes a worried man to sing a worried song. And in a recent speech that seemed like Larry Summers' swan song, the president's departed economic advisor warned that America is at risk of a profound demoralization with respect to government. He fears a future in which an inadequately resourced government performs badly, leading to further demands that it be cut back, exacerbating performance problems, deepening the backlash, and creating a vicious cycle. The idea that America's problems of governance is one of inadequate resources misses this lesson of the last half century. No amount of resources, zilch, zero, nada, amount of resources can prevent government from performing poorly when it tries to perform too much or particular tasks for which it's inherently unsuited. Actually, government is not sufficiently demoralized. The hubris, that is the occupational hazard and defining trait of the political class, continues to cause government to overpromise and underperform. Social scientist James Q. Wilson has noted that until relatively recently, politics was about only a few things. Today, it's about nearly everything. Until the 30s, perhaps the 60s, there was a legitimacy barrier to federal government activism. When policies were proposed, the first debate was about whether the federal government could properly act on the subject. Today, there is no barrier to the promiscuous multiplication of programs because no program is really new. Rather, it's an extension, a modification or enlargement of something government's already doing. That is so true. It is law upon law, redundancy upon redundancy, layers and layers of bureaucratic minutia, next to impossible to maneuver through. The vicious cycle that should worry Larry Summers is the reverse of the one he imagines. It is not government being cut back because of disappointments that reinforce themselves. Rather, it is government squandering its limited resources, including the resource of competence, in reckless expansions of its scope. James Q. Wilson writes, there has been a transformation of public expectations about the scope of federal action, one that has put virtually everything on Washington's agenda and left nothing off. Mr. Wilson suggests that we try to think of a human want or difficulty that is not now defined as a public policy problem. I think Democrats read the newspaper. They find every and any story that points out one human need not met, and they rush to a legislature to make it a bill and then into law. Larry Summers leaves the federal government funded by a continuing resolution. Congress has been so busy passing legislation to expand government that it hasn't had enough time, energy, or sense of responsibility to pass a budget. The pathologies of expanding government are becoming worse because of two concepts Summers mentioned in his valedictory: Baumel's disease and Moynihan's corollary to it. William J. Baumel, Princeton economic professor emeritus, said that in certain economic sectors, that is labor-intensive service industries, productivity will increase, if at all, more slowly than in the rest of the economy. The late Senator Moynihan's corollary was that such services, teaching, nursing, performing arts, tend to migrate to the public sector. Moynihan noted that if you want a string quartet, you must hire 4 musicians with 4 instruments, just as in Chopin's day. Productivity, said Moynihan, just hasn't changed much. When it does, such as playing the minute waltz in 50 seconds, it doesn't seem to work right. Moynihan noted a danger to his party in the tendency for the stagnant services to become government services. The Democrat Party is identified with this very public sector in which relative costs are rising. By contrast, the Republican Party is identified with a private sector where relative costs are declining. And how many years ago was it that Moynihan nailed that? Many. The public sector's involuntary tendency to become, regarding productivity, a concentration of stagnation. The government's involuntary tendency to become a concentration of stagnation is a reason for government to become more circumspect than it has been about the voluntary acquisition of vast new responsibilities, such as 17% of the economy. Larry Summers says he's hopeful
because markets climb walls of worry. Well, they do when markets are free to climb, but Obama's poured oil all over those walls, dug a moat around them, and you can't climb the walls, you can't get out. That is, American history is replete with self-refuting prophecies of peril, predictions of national decline that prompt renewals. Well, this is a really profound and brilliant piece from George F. Will. Government has become a concentration of stagnation that seeks to spread its incompetence each and every day. And to do so, if I might add, they use fear and crisis to garner support for all of this. Is there anything the federal government does not now regulate or tax? I asked that question yesterday. Is there one aspect of human life that they don't regulate or tax or try to? Can somebody name one for me? Somebody says prostitution. Well, I'm not even sure about that. They do regulate it. Well, they regulate it by saying you can't do it, but they wink as they walk in the door. Can you bet that this government disease that Will is talking about is not covered by Obamacare? The government disease. It's consuming us all.